Vitamin B6 is often associated with brain health and hormone balance, but its role in blood formation, particularly in red blood cell synthesis, is just as critical and equally underrecognized. In fact, B6 is essential for hemoglobin production, the iron-containing protein in red blood cells that binds and transports oxygen throughout the body. Without adequate B6, the machinery of red blood cell production begins to falter, leading to symptoms that mimic iron deficiency anemia, fatigue, weakness, pale skin, shortness of breath, and poor concentration. But here's the catch. These symptoms can persist even when iron levels are technically adequate because the body simply cannot assemble functional red blood cells without B6. At the biochemical level, the active form of vitamin B6, pyridoxal 5-phosphate, PLP, serves as a coenzyme in the first step of heme synthesis. Heme is the iron-containing core of hemoglobin. This step, catalyzed by the enzyme ALA synthase, requires PLP to initiate the entire heme production process. If B6 is deficient, the enzyme slows or stalls, causing a drop in heme synthesis and, by extension, a decline in functional hemoglobin. The body may still absorb dietary iron and store it in ferritin, but it can't use it effectively without this crucial vitamin. The result is a form of anemia that is not technically iron deficiency anemia, but rather a functional B6-related anemia. Clinically, this distinction is almost never made. Instead, many people, especially women, are prescribed iron supplements when presenting with fatigue or low hemoglobin, often without a full investigation into other possible causes. But iron overload can be dangerous when given unnecessarily, and it does nothing to correct a B6-related block in heme synthesis. Worse, excessive iron intake can increase oxidative stress and damage tissues, particularly when unbound iron circulates in the absence of proper antioxidant defenses. If the root issue is B6 deficiency, iron supplementation alone won't solve the problem and may cause harm over time. B6 deficient anemia is often described as microcytic or sideroblastic, meaning red blood cells are abnormally small or contain iron that can't be properly integrated into heme. These cells are ineffective at oxygen transport, even if the iron is present. This inefficient oxygen delivery is what causes the hallmark symptoms of fatigue, dizziness, and mental sluggishness. And yet, without testing for B6 status, or without understanding that B6 is needed for the iron handling system to work properly, patients are often left with vague, chronic exhaustion that no amount of iron pills seems to fix. This is particularly relevant in certain populations. Pregnant women, for instance, have increased B6 demands due to rapid cell division and increased blood volume. The elderly, who often have impaired B6 absorption and chronic inflammation, are also at higher risk. People with alcoholism, liver disease, or those taking medications like isoniazid, hydralazine, or penicillamine, known B6 antagonists, may develop subtle or overt deficiencies. Vegans and vegetarians may also be at risk if their diets are low in B6, rich plant foods, and fortified products, or if absorption is compromised. The clinical oversight here is systemic. Most standard blood panels do not include B6 status, and even when anemia is investigated, the focus is almost exclusively on iron, B12, and folate. These are, of course, important, but when those markers come back normal and symptoms persist, the role of B6 is rarely questioned. It's a blind spot in both diagnostics and treatment protocols. Even more concerning is the potential long-term impact of chronic, undiagnosed B6 deficiency on oxygen transport and cellular energy. Low hemoglobin means less oxygen delivery to tissues, including the brain. This not only contributes to physical fatigue, but also to cognitive fog, poor memory, and reduced resilience under stress. These symptoms can feed into other misdiagnoses, chronic fatigue syndrome, fibromyalgia, or depressive disorders, when the root problem is as fundamental as impaired oxygenation due to nutrient insufficiency. Fortunately, addressing B6-related anemia is straightforward once identified. Supplementation with 25 to 100 milligrams of B6 per day, preferably in its active form, P5P, can rapidly correct deficiencies and restore heme synthesis in many cases. Dietary sources of B6, such as poultry, fish, potatoes, bananas, and fortified cereals, can help maintain levels, though needs may increase during times of stress, illness, or hormonal fluctuation. Unlike iron, B6 supplementation is generally safe and well tolerated, with a wide margin before reaching toxic levels, usually only a concern in chronic high doses over 200 milligrams daily for extended periods. But none of this matters if the connection isn't made. Until clinicians and nutritionists begin to recognize that anemia symptoms can arise from more than just iron deficiency, countless patients will remain in a cycle of fatigue, misdiagnosis, and ineffective treatment. The truth is simple. The body cannot build functional red blood cells without B6. It cannot move oxygen efficiently. And without oxygen, every cell from muscle to brain suffers. In this sense, vitamin B6 is not just a helper nutrient, it is an oxygen gatekeeper. Its absence isn't just a missing piece in a puzzle, it's a block in a life-sustaining system. And unless that truth becomes part of routine medical thinking, B6 will continue to be the most essential nutrient you've never been told to check.